enhancing nursing practice through communication, interpersonal, interviewing, and instructional skills. Learning objectives, interpersonal communication in nursing, self-awareness. So before I walk in, I always do a quick check. What am I feeling? What might be a bias in me? I take notice if I'm frustrated when a patient refuses meds, and what is my reaction? That my reaction is not their problem, really. So that's a skill. Skill is name it to really tame it. Silently label if I'm irritated so it doesn't leak into your tone or your body language. You want to, be self-aware of how you are. Then what I do is reflective practice. That's what nurses, we often pause, analyze, and adjust for next time. So after an encounter, ask yourself 3 questions. What went well? What didn't? What will I do differently next time? So if I talk too fast with the anxious patient, maybe next time I'll sit close with them, slow my pace, and use an open-ended question. So keep a 1-minute like notebook near you to kind of jot down notes as you go. So for your own reference, so you can refer to that going forward. Emotional regulations. So I look at my body language and my voice before responding. So micro techniques you can use. Breathe 3 times. Inhale and exhale. Drop your shoulders, lower your voice, slow your pace. And then reset quickly. Just see, for example, like I can see that this is upsetting. Help me understand what's most worrying you. Ask the patient that. And then let's slow down and take this one step at a time. And positive self-talk. Brief, steady phrases say professional. So, and you have that self-talk. Listen first, and say to yourself, I can do hard things. Their fear isn't about me. They're in a sick situation. They're in the hospital. They're in a vulnerable situation. It's not because of me. It's because of what they're going through. So slow is smooth. Smooth is safe. So, and another example is if a family is getting pretty angry, stay curious and just silence. I hear your concern about delays, for example. Let's review what's been done and what can happen next. Be professional, and again, your body language, so stay relaxed, not angry. Don't mirror what the person is mirroring. If they're looking angry, do not put on an angry face. And a exercise for you, write 1 trigger you've noticed in 1 sentence you'll use to stay therapeutic. Empathy versus sympathy. So empathy is about being present with the patient. Empathy is understand and share feelings. Listen and reflect, build trust and connection. So if a patient says, I'm scared about surgery, the nurse may respond with, it sounds like you're feeling anxious about what's coming. This shows that you understand without judgment. You can even share when one time you had your surgery and it made you feel the same way. Sympathy, on the other hand, often creates a barrier, saying, oh, I feel so bad for you that you're going to go to surgery. May sound kind, but it can be unintentionally put a distance between you and the patient, as if you're on the outside looking in. So, but sympathy, it's like a distance and disempowerment, versus empathy, there's a connection and empowerment. So you put yourself in the patient's shoes, versus in sympathy, you say, poor you. Overview of therapeutic communication in nursing. So now that we practiced both therapeutic and non-therapeutic communication skills, let's connect that to interviewing skills. When you're interviewing a patient, lean on therapeutic techniques that you learned. Things like active listening, paraphrasing, reflecting, asking open-ended questions. These encourage the patient to share openly. At the same time, be aware what not to do. Avoid shutting them down with advice, approval, false reassurance, or changing the subject. Those break the flow and harm trust. The ultimate purpose of interviewing isn't just about collecting data. It's also to show the patient that their voice matters. That builds rapport and helps you get the more accurate, honest information about the patient. Core characteristics. At the heart of patient communication is being genuine, respectful, and being empathetic. Patients quickly sense when we are authentic versus when we're just going through the motions. Remember, we don't just treat a diagnosis, we care for the whole patient, their cultural background, spiritual beliefs, emotional needs, and family dynamics. We provide non judgmental care for every patient we take care of. For example, asking a patient, would you like me to involve your family in this discussion, shows respect for their values. Boundaries and limits. Boundaries protect both the nurse and the patient. When a patient, for example, asks for your personal phone number, a professional response would be, I can't share my personal information, but here is how you can reach the clinic or the hospital. Communication and trust. Trust is communication through honesty and consistency. If you say you're going to return in 5 minutes or 10 minutes, you keep that promise. Even small promise follows through shows reliability. Encourage patients to share by using skills like reflecting, paraphrasing, and silence. Therapeutic communication is what we discussed. It's important to understand them and communicate with our patients always in therapeutic techniques. If a patient says, for example, I'm scared about my surgery, you may respond with, it sounds like you're worried about what could happen. Can you please tell me more about that? Being confidential. Only share patient information with the healthcare team that's taking care of them. Do not share any information with people who are not within the team. A good reminder phrase. What is shared here stays within your care team unless there's a safety concern. This reassures patient of their privacy. And our goals ultimately are to help patients build problem-solving skills, coping mechanisms, not to make decisions for them, but to empower them. Phases of therapeutic nurse-client relationship. We're going to go through each and every one of these. So in the pre-interaction phase, this is where the nurse reviews data and self-reflects. The introduction phase, now this is where build trust, clarifying roles, and we establish goals. The working phase actively addresses patient needs, uses therapeutic communication skills. So in the working phase, we're using a lot of those therapeutic communication skills that we learned. And at the termination phase, we summarize progress, plan for closure, and provide continuity of care. So let's go through these. So pre-interaction phase, nurse prepares before meeting patient. They gather their information by looking at the chart, history, and reports. And you also reflect on your own feelings and biases. So this phase happens before you even walk in the room. Like I would be reviewing the patient's chart, medical history, and considering my own reactions. So for example, if the patient has a substance abuse problem, and I don't like patients who use substances, so I need to reflect on my own biases so I don't let that interfere with my care for the patient. So some of the questions you can ask yourself is, why is self-awareness important before meeting a patient? What risks might occur if you skip this phase? Introductory phase. So this is the first impression. Build trust and rapport and clarify roles and boundaries. So this is where we make or break the relationship. A smile, eye contact goes a long way. And depending on the culture, right? The eye contact in one culture is appreciated, in another culture it's not. So we kind of build our introduction. We look at the patient as a whole. We respect their cultural background. Hi, I'm your nurse. I'll be taking care of you today. Can set a really nice tone. If I come across as being rushed, distracted, looking at the clock, playing with my phone, the patient may not open up. So what specific words or actions can you use to help build trust? How can you set professional boundaries early on? So think about that. Working phase. So this is the longest phase, and you would be using all your therapeutic interviewing techniques, such as active listening, clarifying, reflecting, etc. So if a patient says, I'm scared about surgery, and I'll reflect back and say, you seem worried about what will happen afterward. That encourages a conversation. It's open-ended. It will encourage the patient to elaborate why they feel scared. So what communication techniques keep patients engaged? So think about all of those communication techniques that we talked about that were positive. How can you tell if a patient feels heard in this phase? Termination phase. Now, this phase is often overlooked, but it's very important. I may say, today we worked on your medication plan and you practice using your inhaler. That's a big step forward. That gives closure and it reinforces progress. So, how do you end the relationship? At the ending, when you're done with the patient, what would you say? How would you end the relationship while still supporting the patient? Why is summarizing important? Establishing rapport with children in nursing. So, eye level communication. Sit with a patient that's a young child. Sit or kneel so you're not towering over the child, reduces fear and shows respect. Show genuine interest. Comment on their toys, their drawing, or activity. This builds trust. Validate feelings. If the patient is scared, say it's okay to feel nervous. Many kids do. This normalizes their emotion. Provide positive reinforcement. Praise. You did a great job holding still, for example. Appropriate communication. So use age appropriate words like say tummy instead of abdomen. Pace interaction. Give them time to respond. Don't rush. Simplify concepts. Break down instructions. This bandage is like a sticker for your skin. Inclusive discussion. For older children, explain what you're doing and why you're doing it, and invite them to ask questions. Attentive listening. Now show them that you care by listening. Give them eye contact and respond to their concerns. Establishing trust with children and families in nursing. Honesty and communication. Always be truthful, even with children. If a procedure may hurt, this may sting, but it will be quick. Honesty prevents fear and builds trust. Respect confidentiality. Respect what a child or parent shares, and assure patients and families that sensitive information will only be shared with the care team. It's very important to respect HIPAA guidelines. It is vital for adolescents who may only open up if they are safe. Consistency in action. Follow through on what you promise. If you say you'll be back in 5 minutes, return in 5 minutes. Children and families learn to trust nurses who are reliable. Comforting communication. Use warm, calm tone and provide reassurance. Use your therapeutic communication. For example, saying, "You're not alone, I'll stay with you during this," provides emotional safety. Be inclusive. Involve families in care. Encourage parents to stay during procedures if possible, and value their input about what comforts their child. Effective communication with older adults and their families. Recognize sensory impairment. Many older adults experiencing hearing or vision loss. If you overlook this, the communication breaks down and patient may appear confused or non-compliant. So tailor communication. Hearing impairment. Reduce the background noise. Face the patient when speaking. Use hearing aids if available. Give them their glasses. Ensure that they have their glasses for vision impairment. Provide written instructions in large print. Use clear verbal explanation. Also involve their family. Families often provide insights and routines, and they can give you a good baseline of how the patient interacts and what they prefer in their routines. So they can also reinforce the education at home in case that the patient needs education. Adapting to cognitive change. Use simple, concrete language. Ask one question at a time. Allow a time for processing. Avoid medical jargon. So use simple words so the patient can understand. Continuously reevaluate. Older adults' communication may need changes over time. Reassess regularly to keep interaction effective. For example, an older adult may nod politely even if they don't really hear you. Always confirm understanding. Ask them to potentially repeat back the instructions in their own words. Communicating with pregnant women. Recognize emotional and physical stress. Pregnancy brings worries and the patient, their body changes, family, finances, etc. Acknowledge that these stressors to show understanding, and always active listening. Maintain eye contact, nod, repeat keywords to show that you're fully engaged. I hear you, that you're worried about your labor. Let's talk about options. Use silence when needed. Don't rush to fill pauses. Give space. Often allows pregnant women to express their thoughts and fears. Be observational. Observational feedback. Notice nonverbal cues. For example, you seem a little bit anxious today. What would you like to share? Provide clear information. Avoid medical jargon as well. Instead of saying gestational hypertension, say high blood pressure during pregnancy, for example. Addressing concerns. Invite questions. What are your biggest worries right now? This helps guide and supports the patient. References.